There we go. And so again, I will now turn things over to Dr. Eric Gleason.
Afternoon, everybody. Thanks for having us. As Tim mentioned, I'm the Assistant Director of Coos Health and Wellness. I'm also the Incident Commander of our COVID-19 response. I don't know if you've heard, but there is a global pandemic that has recently happened sometime since the beginning of all of this year. So I brought Brian Leone with me. He is our epidemiologist. He is the man with all of the answers for any of the science that you might need for COVID-19. He kind of keeps me afloat during this whole thing. His team works diligently to do the contact tracing for our cases when they pop up or when they're suspected. Brian's team does an absolutely fantastic job of trying to keep the ship from sinking as far as that goes. And we wouldn't be able to do any of this without the work that his team does. Coos Health and Wellness, as you may know, is our local county health department. We have behavioral health and public health housed in the same building. And we try our very best to do for the community what they need. And in this case, it just happens to be COVID-19 response. We are the management team for this response in our county. We're the ones that basically have to answer all the questions as to why things have gone sideways in any particular situation. We have 2 press briefings a week where we get to see Stephanie and Mike, where they drill us for the hard-hitting facts of the cases, keep us on our toes at all times. We have our very final virtual town hall tonight. Brian and I will be doing our last virtual town hall, not because we don't want to do it, but because we just don't have the capacity to do them anymore. We are absolutely swamped with the work that it takes to do and respond to the COVID-19 pandemic. And we are not a very big department, and we have very little staffing opportunities to help back us up. So we have to streamline our process as to why or how we do the work that we do. Tim offered for us to come and kind of speak and tell you about Coos Health and Wellness, but I think what was more pertinent for me is to answer questions that you guys might have as community members, business owners, just community leaders in general, that Brian and I could be here to answer any questions that you might have or you feel that, or points that are important to make that maybe you haven't seen lately. Granted, we can't answer everything. Not all of the information that we have is able to be shared, but we want to be as helpful to the community as possible. And this is just another one of those ways that we can connect with you. Brian, do you have anything you want to share before we take some questions? No?
Fire away. We can just bust out questions.
All right. So
we've been a very busy last 8 days, as if anybody that's been paying attention has seen our case counts spike up. So yeah, we definitely have had to kick it into another gear the last week or so, for sure.
Brian, can you give an update as to what's happened in the last week or 8 days, just so people know where we are?
Sure. So entering last week, we were still over half the cases that were attributed to Coos County were still attributed to the Shutter Creek Correctional Facility outbreak that started back in April and closed officially closed at the end of May after a couple of incubation periods had passed since the previous case had been notified. But we'd had a case here, a case there, kind of happening for quite a few weeks. And then essentially we saw a little jump after about an incubation period away from Memorial Day weekend. And then it kind of leveled off. But the last 8 days has seen, I didn't have a case count in front of me, but we've basically had 3 more cases, possibly 2, maybe 3. There's a question of jurisdiction on one of them, but just since yesterday afternoon press briefing. So I think that brings us to, about 14 13, possibly 14 cases just since last Monday. The context for those has primarily been a workplace outbreak. Thankfully, just, well, so far, seemingly limited to just employees. It's a business that does not really have any public traffic, doesn't interact with the public very much. It's a contracting, tree clearing type service, and they kind of bounce around different areas of the southwestern Oregon. But then there certainly was the potential for community transmission to where those folks lived, as far as their households, and could go from there. There has also been a recent, we're going to be announcing today, confirmation that the medical facility, long-term care facility Avamere, is responsible now for a couple of cases. That's something that's been kind of going around in social media while we kind of barely started our investigation upon notification of a case. And then there's been just kind of a 1 or 2 cases here, 1 or 2 cases there, that are not linked to any specific workplace or anything. There are a couple of, Berea Hospital did mention a couple of cases for employees, but the hospital was not the point of exposure. They were just employees that had traveled out of the area and came back and had gotten sick. So we're not considering that a worksite exposure as much as just a couple of employees that happened to work there and had gone on personal business elsewhere. So yeah, I mean, we're seeing a lot of people traveling, picking up COVID, bringing it back before they figure out what's happening. I think anyone currently that has an illusion that our county's been relatively isolated and will stay that way, hopefully they understand that's just not really going to be possible going forward.
Thank you, Brian. What we'll do for questions is you can do one of 2 things. Either those of you that are Zoom specialists probably know the routine, but there's a section at the bottom that says participants that you can raise your hand and I can call on you, or you can use the chat feature. And I believe Mike had a question, which I think was already answered, which are what are the latest statistics? Mike, if I'm wrong, re-ask that question. Otherwise, I will move on. Deanne, you're raising your hand, so I will go ahead and call on you to ask your question.
Okay, let's see. Am I unmuted? Yeah, I'm unmuted.
Yes, you are.
What do you think about all of these tourists coming from other states to Airbnbs and campgrounds, and are you tracing any of those? I know that we are a destination, and people are coming in and bringing a dozen friends and families and partying, and then they have to go to the grocery store, and then they have to do this, and are you concerned about that influx, because it is the summer and they've heard we have very low numbers and they can come here and party?
Yeah, I think that we are concerned. Travel has not been restricted to the area, right? We don't have travel restrictions like some other states. My daughter went to visit her mom in Alaska, and there's a 14-day quarantine period that must happen once you get there if you don't have a negative test result within the last, I think it was 72 hours or something like that, to show the airline, or like when you get to Alaska. We don't have anything like that. There are a lot of states that have that kind of thing. There are a lot of states that have travel restrictions. We don't have travel restrictions. We can't assume, and I think we've tried to press this a few times, is that we can't assume that anyone is going to take care of us. So we have to take care of ourselves, and by taking care of ourselves, we would then take care of others. So if I'm wearing a mask and Brian has come from Washington, and hopefully that person, he decides he's going to wear a mask to the grocery store, we've done some of the things we need to do to protect ourselves, even if one of us has COVID-19. Adding that with the precautions that we've asked from the beginning of washing your hands, not touching your face, taking those precautions will help in those cases. But unless we have a travel ban, there's really nothing that, or some travel restrictions, there's really nothing we can do about them coming. Brian?
Yeah, and I mean, there's actually a really good example. You know, the only thing that is published are you know, cases that belong to Coos County's jurisdiction. There have been several other instances where we have tracked people that have come to the area, and then we're notified or we find out in some way that someone that had traveled here had COVID-19, and you know, we did some of that follow-up investigation. So some of the work our team does is definitely not anything that shows up in numbers. You know, we currently have over 40 individuals that are under monitoring that have been contacts of cases. There's a lot of states that are overwhelmed. I've tried to confirm a couple of cases in Ohio, for example, and trying to get anybody in the state of Ohio to call me back has been something like a Friday the 13th movie. It's really just kind of been a nightmare. But it's really the travel situation, like Eric said. There are no restrictions on travel right now, and until there are, we just have to assume there's going to be an influx of people. There's going to be a high chance that they are potentially just not sick yet, and that they could be somebody whose symptoms will start blooming, you know, in a couple of days after arrival, and we just have to take that into account. Yes.
That's where that proper use of the PPE comes into place, and the businesses that really kind of, especially ones that might be frequented by tourists, need to be trying to enforce the mask rule that is in effect now, because it protects everybody. It protects the tourists, it protects the business owners, the staff, the community itself. It's not just a willy-nilly kind of thing. There is reasons for it.
Eric, we have another question on what is the status of testing in Coos County? You see TV, huge lines of people waiting for testing in urban areas, but testing doesn't seem to be available to us unless you are presenting symptoms.
Yeah, really, I think right now it's mostly through your provider, or if you call the North Bend Medical Center hotline, which is 541-266-1650, and press 1 for the respiratory clinic to discuss those things. And other than that, we don't have like wild drive-through testing and things like you do see on the TV. And that question comes up a lot. I think Brian fields that question probably twice at virtual town hall.
Yeah, and we've actually have some indications that there may be very well a challenge with the supply line of testing kits again. But from what I've heard recently, especially since a lot of tests are required for someone that doesn't really have an epidemiological link to a case. So for example, individuals that want to do a procedure, an elective procedure, you know, providers are requiring, you know, tests for that. There are certain groups of individuals that OHA has recommended that they should be able to get a test even if they're asymptomatic and do not have a connection to a confirmed case. I think eventually the want and the desire is going to be that testing is expanded even more than it has been, but that is definitely going to be dictated by supply for sure. It's also worth noting there is a significant drop in the likelihood that an infected person will test positive if they are not showing symptoms. So there really is a significant downside to testing before you've started symptoms. Even people that we know are connected with cases that we're monitoring, we do, you know, wait a couple of days, see if you start having symptoms, just so that we can feel more comfortable and more confident in a negative result.
Thank you. Eva, you had a hand up.
Yeah. Of the cases in Coos County, other than Shutters Creek, how many of those are symptomatic and how many have severe symptoms?
So we've only had, we've just had one hospitalized patient for the most part. They're actually, as of the last 12 hours, we have confirmed a second hospitalized patient. I mean, you could argue to what level of acute illness is going to require hospitalization. You know, there are some people that feel pretty bad that, you know, they don't want to necessarily go to the hospital. They're satisfied with, you know, getting testing and cooperating with our investigation through their own primary care doctor, and they just haven't felt like it's risen to the level of needing to go to the hospital. But there have been also several asymptomatic cases. Several of the Shutter Creek cases were asymptomatic. One of our Bay Area hospital cases just this last weekend, she was not showing any symptoms. There are definitely individuals that either have extremely mild symptoms or, you know, their symptoms are just non-existent. I mean, a perfect case example is that the first gentleman that was hospitalized, that has been in the hospital for quite a while, his own spouse that was with him and were exposed to the same things. She did not become ill for a while, and then when she did have symptoms, they were pretty mild. She didn't even think about going into the hospital to seek care. She just had her provider test her very mild symptoms, and they're roughly the same age, similar, you know, medical profiles. So it really can affect different people quite differently.
What is your current, you know, how are you gauging next steps? Are you doing any kind of forecasting in terms of what you can tell in terms of the direction of the county, in terms of whether you're able to expand or have to become more rigid in the controls? And is that even up to you, or are you just going day by day?
Yeah, I'm going day by day and just trying to keep up with cases. However, the state of Oregon, you know, and by the state of Oregon, I mean the governor's office and of course her advisors from the Acute and Communicable Disease Prevention Group at OHA, they're looking at quite a few metrics. Some of them are related to the hospital and their capacity. Some of them are related to our case counts. The first watch list that got put out a little over a week ago by the governor's office, most of those counties were rural, so they're not just looking at total cases, they're looking at rates, cases per 100,000 population. And so a dramatic increase in that rate for a county, which is what we are currently experiencing right now. As far as an increase in relation to some of the other counties, it's probably not quite as bad, but they are certainly going to be taking a look at our contact tracing and case investigation capacity. That's a big one. One of the metrics is 95% of confirmed cases are going to have a completed investigation and contact tracing underway within 24 hours of notification. There are increases in the percent positive of all tests done, not just positive cases, but the proportion of tests that are done, how many of them are positive, because that's an indicator of how much prevalence may be in the community that are so far undetected. So there are a few metrics like that, and the governor's office has mentioned vaguely that basically all options are on the table. Some of those options could be reverting phase, status as far as the reopening status. We're in phase 2. It's not off the table that we might have to get bumped back to phase 1. It's also not off the table that there will be specific targeted measures that are enacted, much like what she did recently with the statewide dropping indoor social events down to a limit of 10, and then increasing mask wearing to outdoor activities and functions where social distancing is not really practical. So yeah, it's out of my hands as far as when those, or, you know, and like I said, it's been very vague as far as how much of a crushing burden that she appears that they look at a county as having before they'll start stepping in and say, okay, we need to make some changes. So just showing up on the list doesn't necessarily mean that we're going to immediately start having adjustments to what's allowed here in the county.
And we also, speaking of the forecasting aspect, I mean, not from like, that's the side, all of the things we know, you know, like Brian mentioned, we have to be cognizant of all of these things. But there's one thing that we've brought up, and I think Stephanie's probably heard it too many times, Stephanie, Mike, we talk about when a holiday weekend comes. Brian mentioned the 3-day weekends we've recently had. Like, we know going into the 3-day weekends, we're anticipating in the next 14 days that we are going to be dealing with the blowback from that, because we have so many times, and I'm sure maybe one of us or two of us have been guilty of this to some degrees. You get around people, you haven't seen them for a while. You start out doing really, really well. You have your masks on, your social distancing, you're doing great. And then it's time to eat some food or have a drink. And then by the end of the night, everybody's hugging each other before they go home. It's human nature. We understand that people are going to be people. So I think we kind of like tighten our boots a little bit when we come out of a 3-day weekend, knowing, all right, here we go. What do we have to anticipate that's going to come out of this? And his team's done a pretty good job of figuring all that out.
I have a question from Stephanie, and then Ron, I think you had your hand up, so we'll get you next. The question, profile of the virus appears to have changed slightly. Originally, it was thought a 14-day incubation, but lately we've seen shorter periods from suspected exposure to infection. Is this true? And if so, what is the thought process as to why this is happening 4 to 5 days instead?
So the incubation period that has been utilized since the beginning has always been 2 to 14 days. The average, or in this case, the median point for incubation has usually hovered between 5 and 6 days, pretty much this entire time. You know, a lot of people, I think, have been frustrated with the amount of certainty on some of the data that we've been able to collect over the last, and by we, I mean public health in general, going back to, you know, February, and it's like, oh, we're July, like, haven't you guys figured this stuff out yet? But yeah, there has been some good news as far as feeling a little bit certain about some things. One of those is there have been substrains of the virus that appear to be, some are a little bit better at locking that pick of the cell and getting in there and causing havoc than others. And so thankfully, those all have not been more virulent, or in other words, cause people to become more ill than other substrains. But that may be part of the reason, you know, the descendants cases of those particular strains are, I mean, we're seeing 2 to 3 days sometimes incubation, that minimum. And, you know, one of those in a group of, say, 6 or 7 cases would not be alarming. But when I've tracked one particular group, I tracked from multiple counties all the way through, and every single chain of transmission was 2 to 3 days before incubation of the next person. And that's we're thankful that those people aren't getting any more ill than others, but that does mean that case investigation and contact tracing is that much harder, because we can, especially with the turnaround time of tests kind of starting to increase lately as far as results. This means that sometimes it can already be 1 degree, 2 degrees of transmission away by the time we find out about the first case.
Thank you. Ron, Stillmaker, you had a question?
Oh, yeah, and I'm not sure this is your area, but in relationship to the rules for requiring people to wear masks, especially in areas open to, indoor areas open to the public, you know, like a supermarket or something. What is the enforceability of that? I mean, is there anyone that enforces that, or is it just up to the property owner?
Well, technically, OSHA, it becomes an OSHA issue. That was the initial direction we were given for enforcement. Like, we can't enforce it. Obviously, most counties don't have the capacity to do enforcement on a mask when they're too busy trying to enforce other things. So it's been more of if you're a business that is not, their staff isn't wearing masks, you're a business that's not enforcing the mask rule, then OSHA can investigate that, and there could be fines levied against it depending on that. But it's really kind of just based on people reporting it.
One of the questions I had asked before the last time when we had a physician in, and we're a little further down the road, but also a little closer to the fall and the next flu season, where are we at? And does this fall under Coos Health and Wellness? But where are we in terms of preparing and in terms of supplies for a confluence of COVID and flu?
I don't know that I want to answer that question. It's like Salem witch trials.
Yeah, I think PPE, if that's what you're referring to, testing supplies and protective equipment, I think we definitely have seen things improve a little bit as, you know, the folks that make that stuff and even companies that weren't making it before and are now investing in that process now, you know, they've been able to kind of catch up a little bit. But you're right, you know, that also happened to coincide with flu season pretty much being over. You know, we see a pretty massive drop in flu vaccinations usually around May every year, and so you know, and that's when also the surveillance that we have shows that it starts coming down. So there certainly is a good reason to believe that when the flu season picks up again, that we are going to have to, kind of strain as far as PPE goes. And there's still certain parts of PPE, especially for our healthcare workers, that is still not a guaranteed availability. There are quite a few problems with that. But hopefully, that's definitely quite a few pay grades above my area to know for sure what's going on there. Just the fact that we were given a vague heads up that our testing supply might start struggling a little bit again in the next 30 days was kind of a bit of news to me this last weekend.
Not good news. Eva, you have a hand up. Yeah, unmute yourself.
Yeah, okay, sorry. When you go into a store, you know, I'm wearing my mask and I'm wearing it properly, but so many people are not wearing it properly, including some of the employees. They've got it down below their nose and they've got it around the side. How do you educate those people? Is there a way to get education out on that?
Our media team has tried to inundate social media and our website with the proper way to wear a mask, all of the educational pieces that we can from our perspective. However, we can't make people listen. Has been our biggest issue. We have a significant amount of pushback. If you go on our Coos Health and Wellness webpage or our Facebook page, just pick a post, doesn't matter which one it is, and then read the comments. It has really been difficult and strenuous for our media team. And like Brian and I, we often just shake our heads when we're having these conversations because it's a really simple task to keep your mask on the proper. It's not that hard, but there's such a cognitive dissonance to this whole thing for some people that don't believe it's real, don't believe masks do a darn bit of good. And so we've tried to educate the community. And I think honestly, if you really went and took a tally, the majority of Coos County is probably doing it right. But then there's those those people that either don't wear the mask or have it, like you said, down here. I've gone to a restaurant that makes that the guy comes out and hands me my food and his mask is on his chin, and I was like, that's not going to help you or me. So
I was in a grocery store in the produce section, and one of the produce workers was there. He had his mask down below, and he was talking to a woman like within 2 feet of her, and she had her mask on. So what do you do there? Do you say to the manager, maybe they need some education on their employees wearing them?
Yeah, you absolutely could.
Yeah.
You could, if you don't feel comfortable educating the person in the moment, you could speak to the manager and say, listen, I saw your staff member over there within a couple feet talking to someone about apples and didn't have his mask up. And it's a safety concern, not only for the customer, but anybody else that might be looking at those apples in the next 3 minutes. It just, you can make those comments and hope that the managers take that into account. If it becomes a repeat issue, then I guess you could run it up the chain to OSHA if you felt that it was grievous.
Thank you.
We have another question. What kind of time has the pandemic and cases added to your workload for perspective from March, April to now? Also, what percentage or how prevalent is the masks don't work in our community, which kind of address that. Well, so that, how does that concern you? Again, address that. So talk in general about the time crunch that you've had added dealing with just the pandemic compared to non-pandemic years.
I think it depends on the positions. I know that Brian's team probably puts in, God, Brian, 1.5 times more work. What are you, about 100 hours? They probably work more than double from their normal work times. I didn't have really, I was the PIO before I was moved up to incident commander, and PIO wasn't as bad, but incident commander is significantly worse. I don't think I have a day, maybe I have a day that I don't hear from Brian or Stephanie or Mike or somebody, or have to talk to the board of commissioners. The teams are mostly trying to do their job that they have in the capacity that they're available to do so, plus a whole extra job, which is the response to the pandemic. In some cases, the jobs that they had initially kind of coincided or aren't being done right now, so they had some flexibility, but they still were added even more to that, probably a 60 or 70 hour work week, just dealing with tracking down everybody that has anything to do with any possible cases.
Yeah. Thankfully, my job and the grant that I was hired for, that grant, the state just converted to COVID-19 response. So I don't really have a normal job that I have to worry about. I can devote all of my time to COVID-19. But I would say, as far as an increase, there was a lot of calls to make during the Shutter Creek thing, but we didn't really have a case that was not connected to Shutter Creek until the beginning of May. And so, yeah, that was a pretty small number that we had to deal with. Of course, we knew that it was likely going to get bigger. We knew that some of the requirements that we were going to have to open was going to be increasing staff. So thankfully, a lot of the time in May and June was spent bringing on some new people, kind of watching them twiddle their thumbs a little bit, trying to get them as much experience as we could in the meantime. So when things really hit last week, we were able to kind of take that body blow and keep going, thankfully. But we're now already pivoting towards, looking at increasing staffing and capacity, because if too much more happens at the level that this last week happened, we'll definitely be at our investigative capacity.
Well, enough of the easy softball questions. What about what is the Coos Health and Wellness concern level regarding going back to school, and how do you counter the argument from those who say, well, it's worse for kids if they don't go to school, and that they're generally not as likely to be impacted by the virus?
Well, I can say, at least from my perspective, and I think Brian might have another one. But as a school board member and a parent of a soon-to-be kindergartner and fourth grader, I would absolutely like to see the kids have the ability to go back to school. However, that being said, we have to be creative about how we do it, because going to school for 5 straight days doesn't make sense either. I have seen some creative plans. I've seen North Bend's plan, which has some merit in its options. I've seen Lighthouse's plan. Both of my girls go there, and they've got some really creative plans. I know that I think Brian and I and the interim public health director very soon will be getting together to start discussing what we'll be looking for in those plans, because public health is going to have a say in the approval of school district plans. So we want something that's going to be safe for the youth and staff of all of our school districts. We also want something that's going to benefit the students in their growth academically. So there will be a balance that we will have to take, but we're going to do our very best to ensure that the students can get the best education available to them in the next school year.
What can be done along those lines? And that's probably some of what you were talking about, but what, for instance, will you be looking at to at the same time help protect the teachers? Is there things that need to be gathered as donations in terms of PPEs for teachers, and what would be best for teachers? Is it the standard equipment, or is it visors, or is it just actually putting the teacher in some sort of a glass partition? Any number of those things just on the table at this point.
Have you seen the John Travolta movie Bubble Boy?
Yes.
Basically that.
Yeah.
No, it's it's going to depend on how many students are going to be in the classroom at a time, what social distancing can be maintained, what their disinfectant processes are going to be. It's hard to say any one particular strategy at this point, because I think depending on the combination of any of those things, they could be different from each school or each school district and still work. So I think it's really going to be up to all of those things in conjunction in some way that it seems safe, that if a teacher's got half of their class for that day, say they went like an A-B rotation, they had half of their class, say that's 15. I say if your worst case scenario, if you've got 30 in your class, 15, 14, and they can be socially distanced, and then that room is disinfected in such a manner that they're not sharing anything with the next group that would be coming in. But it's going to take a lot of balancing, I think, to ensure the safety of everybody involved.
And then I would say one of the things in epidemiology that we look at, of course, is not relegated to just communicable disease. It's relegated to a lot of health factors, upstream factors, that are, we call it social determinants of health. There absolutely is always a push and pull with any intervention that we do about the fact that there's certainly going to be a downside to this. And yes, all things being equal, we want kids to be in class. We want them to have that experience. It's certainly quite a bit better. And there's also access issues. People that don't have as much money, people that, maybe the home environment isn't quite as happy as other home environments. Just blanketly stating online classes are where it's at, and that's the only thing that should be done because of the pandemic that we're in, I think ignores how complex that issue is. So, but of course, children were known as human petri dishes before the pandemic, and there was good reason for that. So to expect, I hope most plans are essentially going to be looking at the fact that they can't really expect a very rigid mitigation behavior set from our children, and we're just doing everything we can to mitigate what we know they're going to do anyway.
I think you're onto something with the giant hamster balls for kids. I think that might be a thing that we could get into.
They've got those ones at the fair.
That's what I was
that
thinking.
They zip up, yeah.
Just produce those, and then if kid gets into too much trouble, you just roll them into a corner. Our districts, last question, I think we're running low on time, but are districts sharing information, and are the talks with Coos Health and Wellness happening now?
Well, I know North Bend has shared theirs with the North Bend families. I know the Lighthouse has shared theirs with the Lighthouse families. I know Coos Bay was sending some stuff out. I know that we are in the process of starting to get those conversations going and getting time to review those. It hasn't necessarily happened yet, but we know that it's something we're all working on planning.
Eric, I'll chime in. Brian and Kevin have been really, conversations are almost daily now in regards to, as we're developing the blueprints that specify those safety pieces as well as expectations as we open. So I know the communication stream is open, and we're looking at how we can make sure that we keep our staff safe as well as our students.
Very good. Eva, you got your hand raised. We got one more we can squeeze in here as we're getting close to the time. You gotta unmute yourself though.
Okay. Many years ago, like historically long ago, there used to be one-room schools, and there would only be a few families in those country places. So if you have a pod of 3 different families and one teacher teaching grade 1 through 6, I don't know. It's just an idea. It worked in the past. Same teachers with the same families. Those families only associate with one another, and they each have like maybe 3 or 4 kids. So, just an idea.
Built-in cohorts.
Hey, there you go. All right. Well, anybody else have anything really quick for Dr. Gleason or Brian? Otherwise, thank you, gentlemen, very much. We really appreciate your time coming by the Coos Bay North Bend Rotary Club virtual room. Hopefully you will come join us again in better days and healthier days when we can gather again and buy you some lunch.
We look forward to it. Thanks for having us.
Thank you very much. And everybody, if you missed my announcement at the very beginning, just a reminder again that 2 weeks from today, our district governor, Cindy O'Neill, will be joining us here via Zoom. So please spread the word. Please plan to be here and tell other Rotarians to plan to join us as well. It'll be a regular Zoom meeting, but with our new district governor. And with that, I will swing back to the bell. That was a week. That was my ring hit the bell. So anyway, meeting is adjourned for another week. Thank you all for taking time to join us. And we got another good guest lined up next week. Taking a look at how tourism is being impacted and what they're doing to try to increase people and help businesses out. We'll talk to the director of the Oregon Adventures Coast. So join us next week. Thank you for joining us. Have a great week, everybody.